Hi everybody, it's Jennifer Milner. I'm here with Doctors for Dancers on free dance training, waiting for you guys to join up with me, and we're going to do a nice little seminar on turnout. So hey to everybody that's joining us. I started a couple minutes early to give everyone a chance to join in, so letting everybody come in. Hi to everybody that's coming in. Hey everybody that's coming in. This is great. I'm excited to do some talk about turnout today. It's something I talk about a lot with my dancers, and I feel like I covered the same ground a fair amount of time. So it's great to be able to sit with all of you guys and tell it all at once. As I'm waiting for everybody to join, hi to everybody that's joining. There's a few things that we'll use if you have them. If you don't, totally fine. But if you do have them, if you have a lacrosse ball or a pinky ball or a tennis ball or something like that, you may want to go grab that. If you have a squishy ball, these are one of those 8 or 9 inch squishy balls, you want to grab this. If you don't have this, foam roller is great, or a small kind of firmer pillow, just like a little small decorative one would be great. If you don't have any of that, that's okay too. We'll do what work we can, and we'll have lots of different options for ways to do it. Hey everybody who's joining in, how are you? Oh, feeling the love. Thanks for whoever just threw the love. Come on in. We'll give one more minute and then we'll get started. Just making sure everybody has time. Make sure you grab your props. Also, if you have turnout discs and not quite sure how to use them, then grab your turnout discs, and we'll talk about turnout discs a little bit towards the end too. Best way to use them, best way to try to work on them. So I've got my turnout discs back here, and we'll bring those out and we'll talk about those a little bit, okay? All right, so I'm going to assume, hey Scarlett, I'm going to assume that people have grabbed whatever props that they need. Small ball, smaller ball. So let's get started. Let's talk about our turnout. So when we're talking about turnout, what are we talking about? We are talking about bones, okay? So the bones that are involved are going to be your pelvis bones and your femur bone, which is going to go in like this. Yes? So these are the two things we're talking about. Finding your pelvis, right? These bones right here all come together and make one bone. And then your femur, which comes up and sits in the socket like this. So that's the bone that we're talking, those are the bones that we're talking about. But I can show you, because I'm cool and I have a skeleton. So don't be afraid. It's not life size. It just looks giant because I'm bringing it up towards the camera. Okay? Here's my skeleton. Hey everybody. So right here is the ball and socket joint. Yes? So this is the back of the skeleton. You can see. I'll let you see that. Here's his sacrum. That's his little tailbone right there. And right here is his hip socket. I'm going to move his arm out of the way. So this is looking at the back, and this is his left hip socket. Here's the femur, the big long bone, and here is the acetabulum. And you can see, sort of in there, you can see it's kind of hollowed out and meant to be the shape for that to be in. So ideally, this bone is going to turn. It's going to turn and go into arabesque. It's going to go up into side. It's going to do so many great things. That's facing backwards. So I'll turn it around. And you're going to see facing to the front. It's going into a side développé. It rotates. It rotates and goes into the back. It rotates and comes up forward. It does so many great things, but we're talking about right here, the acetabulum, the whole socket. And we're talking about right here, the femur and the head of the femur right there. So what holds these things on? Muscles, right? We've got muscles that hold it on. Looking at the back of it, yes, we're definitely going to do workout too, so don't worry. Looking at the back of it, we've got muscles that go from here to here. We have muscles that start on the sacrum and come all the way across and attach. We have muscles that start out here on the greater trochanter and come back in. Basically, they go across like this in some sort of fashion, or coming up and over into here to do that work. So I have a little tiny piece. Yay for having a funky shaped acetabulum. Go Anna's Spear. You are not the only one, I promise you, my friend. So little TheraBand here. And that's the kind of thing that stretches. It looks ginormous there. That's the kind of thing that stretches across. Yeah? And if it attaches here to here, when it contracts and gets shorter, it turns the leg up. And when it stretches and gets longer, it turns the leg in. Makes sense? Gets shorter turning out, gets longer going away. Remember, you're looking at the back of it. So we have the large turnout muscle, which is called the glute max. And that glute max is also hip extensor. So it can lift the leg up to the back. Come here, my friend. It can lift the leg up to the back this way, right? But it also can turn the leg out. Turnout doesn't work super well right here. This way. Okay? It's not really working. Sorry. But that's the one we kind of use too much of, I think. That's the one we depend on too much. So that glute max starts to grip and get tight and hold really strong. And then we can't use it to lift the leg, which is the thing that we really need it for. Or to help jump. It works to take us into jumping because it takes us from a bent knee to a straight knee, which takes us into jumping. So we need to work our other deep turnout muscles too. And there are 6 of them. 6 of them. For those of you that were with me for the ankle, foot and ankle, I named them all then. I will try to remember them all now. We have our stubborn sisters, the obturators internus and externus. The gemelli brothers, gemelli inferior and superior. We have the piriformis and we have the quadratus femoris. 6 very small muscles that do all this little tiny stuff right across the back of the turnout area. Yes? So we have all these little muscles feeding across the back right here. So what we should do is make them work, right? We want those muscles to work. We want those muscles to do that action of tightening and pulling the turnout, or on me, tightening and pulling turnout this way, releasing and coming back to neutral. Now, what else do we have in that area? We have connective tissue. So we have connective tissue like ligaments and tendons. We have a lot of fascia, which is kind of the thin sheath that goes over and surrounds all the muscles. And we have the labrum. The labrum's an interesting little thing here. The labrum is going to be, it's like a little extra docking port, I tell people. So I'm going to use my little TheraBand and I'm going to wrap it around here like this. Now, I have a little extra room for this femur to glide on, because before, what happens if I let the femur go? Look at it, it's sticking way out. There's nothing for it to glide on. Okay, you can't really do that, but if you could, there's nothing for it to glide on. If it goes too far to the back here, there's nothing for it to glide on. So the docking port, the labrum, connective tissue, gives it more surface for it to connect onto, which is great. We like that. What we don't like is when we start to stretch that labrum out by hanging in our oversplits and feeling that femoral head pushing back into it. We don't want to stretch the connective tissue out, because connective tissue doesn't stretch like muscle does. Connective tissue lengthens and then stays there. It doesn't stretch like a muscle and then contract and come back. It just stays there. Like when you twist your ankle, your ligaments stretch, they're not going to come back tighter. They're going to keep stretching and stretching, and ankle's going to be looser. So we want to avoid stretching the connective tissue ligament-wise. However, what we can do is release. There's a whole bunch of fascia that feeds over like this, which is all that connective tissue, and there's a whole bunch that comes down like this. And there's muscles attached to it from every direction. And if we can get those muscles to release, that connective tissue will loosen up and let the sacrum move more, which is one of the things that will help your turnout move a little bit better. Everybody keeping up with me? I know this is deep stuff, but if we can understand turnout, then we can understand what we can do to help it, and we can understand what we shouldn't do to help it as well, right? So we want to understand things that can affect our turnout. Yes, McKinney Movement Center, I know you are feeling me. I know you're with me. We want to think about what is going to affect our turnout. First of all, how we're built, right? If we look at that hip socket, some people are going to have an acetabulum that looks like this. It's going to be big and wide, and it's going to have lots of room for that femur to excursion on, like that, right? Plenty of room for that leg to turn in and turn out, okay? So that kind of person would have a lot more turnout. If somebody has a deep hip socket like this, you'd think, oh, look how nice and deep my hip socket is. But what happens? You start to hit the hip socket in the different positions a lot sooner. So a deeper hip socket would mean that you don't have quite as much natural turnout. You don't have as much as if somebody has this and they have free range to go running around, right? So bones can be part of it. You can also have muscles that can be tight or weak if you're internal rotators are tight, then it would hold you back from externally rotating, because when you externally rotate, you feel them start to stretch, right? So if your internal rotators are tight, they're naturally going to hold you that way. So we want to release that. How did I not know this? Oh, Chantal, I'm so glad I was able to give you a light bulb moment. Being able to release those muscles is important, especially when we're trying to find what our full range of motion is. Our external rotators can be tight too. Sometimes dancers will grip those external rotators and hold them. Like stand and we'll turn it out, and then we'll like grip and hold onto it and kind of hold it tight the whole time, whether we really need to or not. And we'll use those as stabilizers. And when we use them as stabilizers, they get used to being just like this. And then you call on them to move in a full range of motion and they can't do it. So sometimes we want to release our turnout muscles as well to give them that full range of motion. Sometimes one of your turnout muscles, your piriformis, may be a great turnout muscle this way, but when you come forward and bring it up, the direction that it goes, some people feel like it can actually rotate you internally. And so having a tight piriformis might be pulling you this way to the front. So you may have a different turnout, and most people do. You may have a different turnout to the front than to the side or to the back. So you can have a great turnout front, and then as you go to the side, you feel it start to turn in. Or you may have a really nice turnout to the side, and it goes to the front, you feel it start to turn in. Some of that's your structure. Some of that just happens to be what's tight, and some of it is what's weak. If our turnout muscles are not strong in the full range of motion, we're not going to get full use of our turnout muscles. And then you can also have things like your psoas can be tight, and you can have muscles that come in towards that area that feed into all of that fascia back there that can cause it to be tight. I've seen dancers with really tight psoas, with a really tight psoas, and if they can get that released and stretched, then their turnout increases in specific ranges, especially to the side. And some of that is just because of the way that everything feeds together, and some of that is because it doesn't allow the sacrum to move as much. It all gets kind of complicated and tied up, but the good thing to know is there's things you can do. Connective tissue can be affected some because you can release the muscles that attach into the fascia, but as I said, we can't stretch those. We don't want to stretch those ligaments, and we don't want to stretch that labrum. We want to leave that labrum alone. We want to leave the ligaments alone to do their job. They're strong and tight for a reason, right? That's their job. So, where does turnout come from? I mean, we've just been talking about it, right? Hopefully everybody just answered. Will this be available to watch later? I missed the start. Sarah, we are hoping it will be available later if I can save this. Sometimes I do it, right? And sometimes I don't. But yes, we're hoping to have it saved for you guys. So the turnout, yes, Laura Figueroa, comes from the hips. Thank you, girl. Comes from the hips. Where does everybody, yes, Chantal, now everybody knows it comes from the hips. Where do we like to have it come from? What are some of the places that we have it come from? Can anybody say knees? Can anybody say feet? Right? Now, in reality, as Danielle is pointing out, it is not 100% from your hips. The number, yes, ankles, legs. The numbers that I look at that I've seen studies-wise says you get about 80% of your turnout from your hips. For teaching purposes, we say 100%. I never have to teach someone how to turn out from their knees or their feet because everybody's going to instinctively try to get that last little bit. So I teach purely turning out from the upper part of your legs, from your hips, and everything kind of comes along with it. For me, it's knees a lot, yes. So that is a great question. I will try to come back to that question. So when you're working your turnout, I want you to concentrate on your hips. Now, what does it look like if you turn out just from your knees or from your feet? Because it's hard to tell sometimes when you're stacked up. Some people have extra turnout in their knees or their feet. I'm one of them. So I'm going to show you what that looks like, okay? So I'm going to move this down. You can see my ginormous knees, and then I will back up. Okay, so you can see my feet are pointing straight forward, right? My knees are pointing straight forward. My hips are pointing straight forward. Now, what's it going to look like if I turn out just from my knees and also from my feet? It's going to look like this. Look at the direction my knee is going in. My knee is still facing straight forward. My kneecap is still facing straight forward. It's angled off a little bit to the side, but I have turned my tibia, my lower bone, out. Kneecap is still forward, and all I'm doing, I know, It used to be worse until my PTs got a hold of me and I've been able to fix it, but it still hangs out there sometimes. So you can see, you can twist a lot from your lower legs, but your knees are going to stay straight forward. So if I bring my feet back together, what happens if I try to turn out from my hips? It goes like this, right? My hip is doing the work and I'm just letting my knee go along with, I know, Daisy, it's not right. But I'm going to let the hip do the turnout work instead. If I turn out from here, what's going to start hurting? My knees. P.S. Coincidentally, knee surgery on this guy. And that's when they were like, hey, you should stop doing that. So I didn't even know. Thank you, Carrie. It's good to know my weirdness is good for something, right? So it's good to know that you're not doing everything right. It's good to know that before you have to have surgery, before you have to deal with it. Yes, you also get a little bit of motion just from your ankles. There again, I'm not moving my shins at all. I'm just moving through my ankles. I have hypermobile ankles and tibias and all that, yes. So no, we don't want surgery. We want to turn out from the hips. Everything else will spiral with it and give you that last little bit as needed, but hopefully not too much. So I'm going to move you back up. And as I said, turnout can change depending on what position you're in, right? Sometimes turnout to the front is going to be different from turnout to the side, is going to be different from turnout to the back. So we want to figure out how to strengthen it in a way that a variety of positions, right? First thing we want to do though is roll it out. Let's see if I have my little prop. Well, I had a little marble, which has now disappeared, which was the perfect size. Oh, there it is. Okay, so we want to roll out, and I like to roll out two different areas. The first one, let's see, is going to be our sacrum. So again, this is the back of this guy, right? And this is his sacrum, and that's his tailbone. So we're going to take, let's see, there it is. We're going to take your lacrosse ball, which is a marble for this purpose, and we're going to try to roll along the sacrum here. So, let's get my hand out of the way. I would like to roll this part here. I don't want to put the ball on the sacrum. I don't want to put the ball on the tailbone. I'm trying to get right into this space where there's all those little tiny muscles that attach. Another great place that I'm going to try to roll out is right in here, into that empty space, trying to roll out all of this, and even coming up right around here. There's a lot of stuff in here that you can roll out too. This is the one that I want to caution you on the most. It's a great spot to roll out, but don't put it right on your tailbone, okay? Remember, this is your lacrosse ball. As you try to roll things out, as I break my skeleton, as you try to roll things out, make sure that you're not feeling any numbness, any tingling, shooting pains down your legs, anything like that that might signify that you're pressing on a nerve or that you're pressing on a vein or an artery. We don't want to do anything that feels weird or feels wrong to you. So what does hypermobile mean? Hypermobile means hyper, extremely mobile. It means lots of mobility. So it means that instead of having an arm that goes straight like this, you have an arm that goes straight like that. There's lots of dancers who are hypermobile, and so that's an issue that I address a lot. That's one of my areas of expertise. Would a golf or tennis ball work? Yes. A tennis ball will be slightly softer than a lacrosse ball. And yes, I am trying to save this. I am hoping that it will be saved. A tennis ball will be slightly softer than a lacrosse ball. A golf ball will be a little smaller. It will be harder. So it might hurt more. We're not trying to kill ourselves. We're trying to get in and do some real release work, right? So I'm going to talk us through release work really quickly so you can see what we're looking at here. So again, we want to take that ball and we want to go right along the inside of our sacrum, and we want to get right into any area here and any area right along here that we can that feels good. The first way that I like to get in along the sacrum is lying on my back. And as I lie on my back, I'm going to put one hand underneath it, and right here are my PSISs, those little knobs that stick out on your back. I'll put one hand underneath my back and I'll put the ball right along that border on the other side, okay? So I'm going to demonstrate that. Is a squash ball too small? Like a racquetball? A racquetball is probably not too small. Again, this is not high tech. So find something that works for you that doesn't hurt too much. Find something that works for you that is going to help release it. Don't be afraid, okay? Get in there and do whatever feels good for you. So, lying on your back, I'm going to put the ball underneath the right side up near my PSIS. And I'm going to put my hand underneath the other side to keep me level. So I want my hand to help tip me onto that ball. If it's too intense, take the hand out and it'll drop you back down. I like the hand because my sacrum is hypermobile, and so it helps keep me a little more even. But I will find a spot to lie on and just relax and see if I can let that ball go into that spot. Trying to clean right along the edge of that sacrum. When you get to a spot, letting that knee fall open probably will intensify it. If it does, but you feel uncomfortable letting that knee sit up, you can take a ball or a pillow and put it under your knee to help hold your knee so you don't feel like you're having to hold your knee up against the floor, against gravity, right? So finding a spot that you can sit on and trying to let yourself relax into it. I tell my dancers to think about the ball being an ice cream cone and the muscle is the ice cream, and you're just going to melt over the ball, right? So we're going to try to let yourself melt over it. And you're going to scooch a little bit every minute or two, sliding it down the tailbone. Yes? If the knee up feels more intense or the right amount of intense, that's fine too. You find a position that works for you. This just changes where the sacrum is slightly. Yeah? We're looking to get at all the stuff that attaches along that sacral border. That's all we're looking for. So, you guys keep breathing. I'm going to sit up and make sure I'm not missing questions. I'm not able to find it. Not able to find a spot. That's okay. There's so many spots. So, take that ball and just find a spot. For you, it might be somewhere in here, right? Let's see, I'll stand up. Somewhere in here. I'm leaving with that right there. Anywhere down around in here is going to be great. I like to go right along the sacrum. If you can't find right along the sacrum, you should find a spot where the ball is either on the bone or it's just off of the bone. So if the sacrum's here, you can either be right on it or you can be rolled right off it and going along the edge. So hopefully everybody's rolling the ball down towards their tailbone and letting it come a little bit lower and a little bit lower and release it. Is a ball from Suffolk a good size? Yes. That's a great size one. I think it's right about this size. Or it's like a pinky ball, which is very similar. So hopefully by now you've gotten down towards your tailbone. And we're going to switch and take that ball out from underneath. But before you do, before you switch to the other side, make sure you've gone all the way down towards the bottom. You may need to arch your back a little bit to get along the edge of the tailbone. Again, do not go on the bone. Do not do this if anything feels weird. If you've had a history of deviated tailbones, broken sacrums, anything like that, please don't do this, right? And then we're going to take the ball out from under and put your whole pelvis flat on the ground, both hands out, and see if one side feels different than the other. My right side feels meltier, feels like it's dropping more into the floor, and my left side feels tight and kind of crabby and held up. So, let's flip to the other side. Let's be nice and do both sides, right? Lying back down. Everybody still good? Yes. Lying back down, taking that ball, going somewhere up high, not on your PSIS, but out near, below it and towards the sacrum. Finding a spot. Everybody's spot might be a little different. Finding a spot that you can let your pelvis relax onto. And seeing which one feels better. Turned out or turned in. Or maybe you want to go in and out, kind of floss your way through it. You may be trying to get turned out but not quite ready to be there yet, so you may fold that knee back in. And just linger there for a few seconds and fold back in. And again, if you're having trouble with the turned out position, you can put the ball underneath that knee to help hold it, or a pillow, or anything like that. And taking your hand out from underneath the other side will keep it from being quite as intense of a sensation. Moving that ball down a little bit. The more that you do this, the more your body will crave it, and you will start to feel really good when you do it. This variation was taught to me by Lisa Howell. Lisa Howell is amazing. She's an Australian physiotherapist, and I love this version because it doesn't hurt my shoulders to hold myself up like sitting does, and it's nice and efficient to get along that tailbone. So if you have not seen Lisa's stuff, I highly recommend it. Finding those spots up and down, letting that leg relax open, or going in and out. And going a little bit lower, right towards the tailbone, maybe arching a little bit, staying off of the tailbone, right? Nobody needs to mess around with their tailbone. And then let's take that ball out, put both sides down on the mat, and see if you feel closer to the mat. My back feels a little warmer in that area. Everything feels like it kind of dropped and relaxed down a little bit. And my legs feel grateful. Like I've taken some of that stress off. So, let's go. Lisa is amazing. Yes, isn't she amazing? I love her stuff. Seriously. Her website is the Ballet Blog. She's got great resources too. So, you feel that, E.K. Ripley? You feel that nice softness to it? Now, that has released all along your sacrum. Everybody that has done it, just stand up. See what it feels like. Now, we didn't really do a check at the beginning, but stand up and walk around a little bit. See how that feels. Does it feel more open and loose? You said to avoid spots that cause shooting pain down the leg, but is a strong sensation down the leg okay? That's not my preference, because if you're feeling a sensation down the leg, then you're probably on a nerve, which is going to refer that pain down that way. We want to avoid that. You may be releasing a muscle that has trapped a nerve, but to really do that healthily, you'll probably want to go see a physical therapist or a specialist who can work on you, like a dance chiropractor or a physical therapist. So that would be my recommendation. I try to avoid things that cause pain that refers somewhere else. Okay, so let's go back to the small ball. Hopefully everybody's booty's feeling kind of nice and loose. And with the small ball, we're going to try to release a little bit further out. So right now what we've done, if this is my sacrum, we've released like right along the line. We're going to go a little bit further out and try to release more of the glute max and more deep into the piriformis. So we're going to take the ball, and instead of going, I'll back up so you can hear me. Instead of going along the sacrum, we're going to go further out, and we're going to sit up for it. So I have a side knob called my greater trochanter, that bone that sticks out on the side that everybody has. And I'm going to go just inside of that and find a spot that usually does not feel good on dancers. And I'm going to sit on that. So this is going to be sending my weight towards the ball. And in this position, I like to have my knee closed to kind of open that joint up to let the ball get in. But you can try it with your knee open. You can try it with your legs straight. Let me back up a little more. You can see I'm just popping myself onto the side. And I'm going to find a spot. You can roll back and forth, but it's better to just kind of sit there and try to let it relax. See if you can let yourself relax on it and loosen it up. Maybe turn it in and out a little bit, but try to just melt onto it. You will probably find a spot where your knee bent and in parallel gives it the most significant release, and you can stay there, or you can go in and out of it. And then hopefully from here, you could spend half an hour here rolling all of this out, rolling out your glute medius, loosening up your hips nice and soft. But we're just going to try to get through this so we can do some exercises too. So we'll get to the other side as well. Same thing, finding that spot and popping onto it. And seeing if you can loosen it up. Knee can be slightly closed, knee can be open, leg can be straight. This is what I get worried about, is I get kind of, melty into the floor myself. So this also helps relieve the sciatic nerve, right? Yes. So one of the main things people look at when they talk about sciatic nerve issues is the piriformis can impinge the sciatic nerve, and this releases the piriformis. So it can, yes, as long as you are not feeling like you are pressing on the sciatic nerve or feeling shooting pain, numbness, tingling, anything like that down your leg. This will help, or could help, with sciatic issues, yes. And is common for it. Just make sure you're not getting too schlumpy. And I like to go down and release right along the greater trochanter as well. I could stay on that for another 5, 10, 20 minutes, but let's stand back up and walk around a little bit, see what that feels like. Feel a little bit looser. Feel like you have a little bit more movement back here. Feel like my tailbone has dropped a little bit. I feel like I'm ready to go. You guys ready to go? So, exercises. Let's do this. Does anybody have any questions this far? If you do, throw it up on the screen and I'll try to grab it before I start doing too many exercises. But in general, what we want to do is identify what our possibilities are, right? What can we change? We can't change our bones. Oh, good. Thank you, Laura. You can't change our bones. We don't want to change our ligaments and our labrum, but we can try to release the connective tissue called the fascia by releasing the muscles that attach into it, and we can release the muscles, right? So we are trying to give our body a fighting chance to optimize its turnout as much as possible, right? Should we be warm before rolling? That's a great question, and I like rolling as one of the things that we do to warm up. I've trained my dancers to do this before class every day. I love when you clean along the sacrum and when you release the side of the tushy right before class every day. And most of my dancers will take these balls in with them to class, if their teachers let them. They'll take the balls in with them to class and sit down between bar and center and do a little more rolling out. Try to release it if something feels funky in a combination and they know that that's what it is. But these are professionals and they are allowed to have a little more judgment call with what they're doing during class. Please be respectful to your teacher and maybe roll out if you're a pre-professional in the dressing room while you're chatting with your friends. The type of rolling out I don't like to do before class is if you're going to sit on it for 20 or 30 minutes, like there's a lot of rolling out you can do for your calves that gets into some really deep spots. But that can sort of shut those muscles down, and we don't want to do that. We don't want to shut them down and make them vulnerable and then send you off to dance. So a good rollout, a 5 to 10 minute rollout to get these muscles warmed up and loose and ready to work is great. Hanging on it for half an hour is going to be overkill. That's the type of thing we would do afterwards. But rolling out with the ball, absolutely appropriate to do before classes, before rehearsals. Okay? Great question. All right, so let's go into our exercises. What is the exercise that pretty much everybody makes you do, right? Clamshells. Everybody does clamshells. Clamshells. Clamshells are not my favorite when someone just throws them at you and says, go do these, because everybody can cheat at them. So when I work clamshells, I'm going to tell you about it first because I don't want to be too far from the voice, and then I'll drop this down and move back a little bit. When we do clamshells, we have a few ways of doing it. We can work from the front of our hip. If I'm going to be in plie, and here I am lying on the ground, and I'm going to do a clamshell, and I'm going to open one knee, I can use the front of my hip because I have a muscle called my sartorius that does this. So I might cue into the front of my hip to help me lift and open that knee. And as I do it, I'm kind of jamming my femoral head forward. And instead of doing that, I want to think of rolling it open and back. So I want to think of this muscle sliding back and off. I don't even want to think of a deep plie. I want to think of it just kind of sliding back that way. I'm trying to get my quadratus femoris, that really small one, muscle to help me out. My obturators for sure, my gemellis sure, but I'm really trying to get that quadratus femoris to start working. So the cueing for me is going to be from the back of the leg. So there's two ways to rotate, okay? You can put a key into the lock and you can turn the key. And what happens? The lock stays center and the key turns within it, right? Or you can turn a page in a book. Think about, here's a page in the book and I'm going to turn it, and it's going to be over here now. This is the center line right here that gets pivoted around. And when I'm lying down and doing my clamshells, if I think of turn that key in the lock, then I start to kind of shove forward and lift the knee up rather than turning the page in the book and letting it excursion more in the hip socket and roll back. So that's what I want you guys to do, okay? I'm going to drop you down to the floor. You can hang out with me down here. Hopefully you can see when I back up. Yay! Okay, so we're going to be on the floor for our clamshells. We are going to make sure that the knees are not at 90 degrees. We're going to try to bring either the feet in line with the spine or the knees back even further. Yes? So if you were looking at a picture of me from down there, I would be a straight line right now from my shoulders to my knees. I'm going to bring my knees a little more forward, but not super far. Now, hips, we want to try to get them stacked up. All my smart friends out there, you can tell me after this how I did. If I kept myself in good position. But right here, we want to have stacked hips, and I want to have this thigh lift up, but not lift, slide down and back. I like to think of pushing my top heel down into the bottom heel to help lever that knee up. Like I'm going to push down on one part so the other part lifts up. That's going to fire the back of my leg more than the front of my hip. I also like to think of starting to straighten my leg rather than starting to bend my leg, because that really is going to fire my sartorius in there. So if I can push down with that leg and feel my muscles slide down off the back like they're going to go like that, that's what we want to do. So keep doing that. Push down with the heel. Feel that, press down to pivot it, right? To lever it up. And then let it soften back down. Think about what's going on here. Don't drop it out. Keep it pulled in. Keep your hips long and straight. As the knee opens up, don't let the hip come up. And try not to shove that femoral head forward. You'll feel it more deep in here, which is your obturators. Still turnout muscles, but we're trying to target back there, right? Let's do 2 more of those, pressing down. And lower back down, and let's do 1 more, pressing and rotating. And lowering back down. Sweet. Now, we're going to do a whole series here. Let me come forward so I can chat. We're going to do a whole series here, and I don't want you to do too much. If you start to feel super tired, don't keep going because you think that I want you to, okay? I want you to keep going and doing what's safe for you. I want you to feel it strong. Thank you. I want you to feel it strong, but I don't want you to injure yourself because none of us can come help you because we're all housebound, right? So let's go from there. We're going to go into, what did I do next? 90-90, yes. Okay, so grab your foam ball, if you or a small ball if you have one. Grab your foam roller if you need that. I'll grab one to show you. Foam roller, or you can use a smushy pillow. I felt it in the front of my knee. If you felt it in the front of your knee, then you are trying to turn out from your leg. You're pushing your knee, your heel down, which I told you to do, but then you're trying to lift from there. And that's a common place sometimes for people to feel it when they're working not the way we want them to work. I'm not going to say cheating because I don't think you're cheating. I think you're trying to do it for sure. But I want you to feel it as if it slides down. So don't even try to lift very far. And maybe, Melanie, for you, don't think about even pushing down in it. Just think of turning out and sliding down. Pressing that heel down may help, it may not. So let's move to a different position. Bringing that knee forward into 90-90. Hips again are going to be square. You do not have to force a long, perfect waist. I don't want you to be uncomfortable. In this position, 90-degree hip, 90-degree knees, I'm going to have you hold something between your thigh and your calf. Okay? It can be the ball. It can be the foam roller. Ta-da! It can be a yoga block. It's whatever. It can be a pillow. It's whatever you've got. Yes? This is just going to be to help us see where our turnout is coming from. In this position, we're going to lift to parallel to the floor. And from there, we're going to rotate that knee to an a la seconde attitude. Okay? Notice I'm not shoving my heel forward because that would be a devant attitude. And you'll see very clearly if you do that because the ball's going to move. Keep the ball where it is and just rotate from the thigh. Feel that rotation and feel it come back down. In that end stage, you might feel like letting the hip rotate open. Fight it. Just the thigh rotates up. Should feel it in the back, shouldn't feel that heel coming forward, and it rotates back down. All of my dancers watching have probably done this. It is killer. And this one, I steal from everyone. Listen, best advice I can give you for your life, find really smart friends and then just steal from them. They are the best. I think Marimba Watts gave me this exercise, or first brought this exercise to my attention. I love this variation. And she's an awesome Pilates trainer out of New York City. And we're going to do one more. And we're going to lower back down. Everybody burning yet? Now, we're going to do a step that's similar to a rond de jambe. It's, I learned it as a rond de cuisse, you know, throwing the leg when you do the rond de jambes. But we're going to lift it up. We're going to rond de jambe it back. You're going to feel it start to reach to the back. Hips stay square. It's going to go slightly behind you and bring it forward. So we're doing a nice full circle, trying not to arch that back and bringing it in. So now we're working that rotation as we go to the back, feeling that length. And we are working all hip. There's no cheating allowed to happen with that leg, is there? And let's do one more because this kills. Reaching it back. Beautiful. Now we're going to put the ball down. It kind of crunches in the sartorius area. Is that normal? No. I mean, it is something that I do see because dancers have a fair amount of front of hip issues. You shouldn't feel that crunchiness there. So that means that you need to have someone help you figure out what's going on with the front of your hip, with your hip flexors and that kind of thing. Hopefully that'll loosen up and it'll give you the freedom to only work back here. If this is all tight, then you're not going to have that freedom to glide the way you need to. Okay, so we're going to do one more and then we're going to flip to the other side. This one is from my friend, Carrie. Hey, Dr. Carrie. Totally stealing this from you. So we're going to take our legs down. Dr. Carrie Sconey, I should say. Look her up because she's awesome too. She's a chiropractor who works with dancers. We're going to have a nice stacked waist. Now, if you could see my lower legs, you would know they are turned out. So I'm going to come up high so you can see. From this position, turn both legs out, right? As you turn both legs out, don't bring your legs forward. Don't do something weird with your pelvis. Turn out. Yes, she is a member of Doctors for Dancers, so you can find her there. Dr. Carrie, you can. And go back to parallel. So we're going to turn out. We're going to stay in that turnout the whole time. Yes? Now, everybody should do this much better than I do because you're not retired. So hold your turnout, and then from there, bring your leg up into passe. In that passe, watch where your pelvis is. Keep that nice long line. Développé just to 90, still holding that passe, or still holding that turnout. Now what happened to your top leg? Hold that turnout. It may not be straight to the ceiling. It may be a little bit forward, but we're going to hold that turnout. Then, holding that turnout, let it glide in the socket. Feel, I'm going to use my hand here, feel that turnout deeper as the leg as the leg comes up. Don't let it turn in. Let it turn out. Bring it back to 90 and slowly lower it back down, holding that turnout the whole time. We'll do it one more time. Pull it up. Feel that hip stay square. Feel that nice high passe. Don't stop. And then développé. And once you've développé, check what happened to your turnout. Hold that turnout for me. Let it float higher as far as you can go without the hips going weird. And then slowly lower it back down. Good. In the interest of time, we'll only do a couple of those, but we often do about 4 to 6 of them. Now we're going to take it up. This one is killer. I will talk to you through it, but please do not do it if you're not quite ready. The leg is going to come forward into a front rond de jambe. Look what happens when you let it turn in. Hold that turnout, and then lift it back up. This one is no joke. Hold that turnout. As it comes back down, think pinky toe reaches towards the ground instead of big toe. Pinky toe, and then reach it back up from the back of the leg doing the work. One more time. Yeah, you can really feel it. Good job, Scarlett. And reach it back up. And fold it back down. Now, good news is those are killer and they work really well. Bad news is we have another side. I'm sorry. So let's do the other side. And it's going to be awesome. Have your ball or whatever you need. Get it ready. Here we go. How are we doing on time? Okay. Lying flat. Knees are going to be bent, but remember we're not going to bend them super far. We're going to take them a little further out. I like feet in line with your pelvis or feet back behind your pelvis, whatever you can manage. And you're going to rotate. I keep turning in when I try to go to the front. You know what? That's totally normal. Turning in when you try to go to the front is normal because it's easier. These muscles don't want to have to hold against gravity. That's one of the things we're working on. And if it's too hard, lower the knee down here and turn back up. And then bring it to 90 degrees and lower and bring back up. Leg out straight is a long lever. It's really long lever that you're trying to lift. So start with the knee in, then bring it to 90, and then take it all the way out. And it will work. Side plank or single leg bridges. Hang on. Is it okay for the last one in the quads? If you felt that last one in the quads, it may be that you were trying to keep the knee straight, which is totally fine. If you feel it in your hip flexors, we're trying to use less hip flexors and more tushy. So again, change that lever, but you will feel it some. Okay, hopefully everybody has been doing their rotation here. You keep going while I read. And lowering down. And one more time, rotating. And lowering down. Yep, get the glutes going. It definitely does get the glutes going, but it should also get that little tiny turnout muscle going, the quadratus femoris. I don't need to see you squeeze your booty. You should be able to rotate it, and my whole superficial glute, at least, is completely soft. From there, bring those legs into 90 degrees. Take the ball, hold it, stack your waist up, and we're going to rotate it open. What? And rotate it back down. Anybody that has hip issues, if this bothers you, stop before it bothers you. We don't want to deal with any impingement problems, right? No need to try to push through any pinching in the front of the hip. Lifting it up. You keep going while I read. I feel my hamstring more on this side. If you feel the hamstring in the back of your leg, that's great. That's just your leg holding the ball would be what I guess. So I would be okay with that if that's what's really happening, okay? So yay on hamstring, because hamstring brings your leg into passe. Let's do one more. We need hamstrings in this position. And lower back down. Now we're going to lift it up, and we're going to go into that full rotation. Take it long, and bring it in. I'm running into the stuff back here, so I can't go super far. But think about a nice long line. Hips stay square. And again, I can't see you, so I choose to believe you are all doing great. I choose to believe y'all look amazing, and everybody's burning, and everybody's making faces at me because it hurts so much. But in a good way, right? Because I think you guys are doing a great job. And let's bring it back in, and let's rest. Now, let's take our legs straight. Remember, we're going to turn out those legs. Turned out legs. Right underneath us in a nice long line. Find that turnout position. Find that straight line. Don't bring them forward like a kickstand. And then we're going to bring that leg up into passe. Don't sit back with that hip. Think nice high passe. Think hamstring to help you bring that high passe up. Develope it up to 90. Again, find that turnout. We don't want it to be turned in. Find that turnout. Let the leg float up higher, keeping the hips square, and slowly lower it down. One more. Pull it up. Again, we would do 4 to 6 of these. Take that leg up, holding that turnout, lengthening it up overhead, and slowly lowering it down. Still stacked with the hips. Let's bring it up to passe. Take it back up. And now let's lower it forward. As we lower it forward, think the heel comes with. The heel comes with. If this is too hard, bring it into the passe. lower it down, and bring it up. Bring it out this way, lower it down, and bring it up. It'll be parallel to turned out, but you'll start to add weight. Once you've gone here, hold that turnout as you lower down, and bring it back up. Bring it into here, try to bring it forward, and bring it back up. Just not putting quite as much weight there. Let's do one more. If this is too hard, which this is ridiculously hard. Thanks, Carrie, for showing me this one. My dancers are so happy. And slowly lower it back down. Aw, thank you. Is it normal for me to have less turnout on my left side than my right, Chantal? I hate to tell you this. You and everybody else. Everybody, it's very common to have your hips slightly different. So one hip might have a little less opening than the other hip, or one hip might have a little bit different growth, the way it folds in, than the other hip. It's totally normal for your hips to be built differently. One leg might be set slightly more forward than the other one, right? When you're standing, instead of being set both of them like this, one might just naturally be set this way in the socket. It also could be muscular and that kind of restrictive tightness. So if it's something you really want to work on, go to a PT or a specialist and have them help you with that and see what they can find. In general, one side's usually more turnoutable than the other side. Don't cry. Okay, let's look at turnout discs real quick. And even if you don't have turnout discs, you can do some of this work, okay? Oh, before we do that, sorry, I want to add weight to it. So, before we do turnout discs, which we may not get to, we might do a whole session on turnout discs, right? Before we do that, I want to add weight to your turnout work now. So we've been lying down. What we've done is changed our position to gravity, right? We've changed gravity and how we're working against gravity for our turnout to try to isolate that. And then what happens is we want to stand up and make it more practical, add on to it, but not just throw ourselves into class, because in class we have a set way of doing things. We want to start tapping into those muscles. Exercises every day. How many reps of each should we do? I'm not going to tell you how many reps of each, because you should do it until you feel a fatigue. I don't think you have to do it every day, because if I tell dancers that, they obsess about it and then they get mad at themselves if they don't do it. I would say aim to 3 to 5 times a week, right? At the most, okay? Depending on how much of this you're trying to work on. But let's do this real quick. Let's go into our standing position. So we're going to stand and we're going to reach back into a nice deep plie in parallel, and we're going to come up into a passe, okay? Think pelvis is square, pelvis isn't sitting back, it's nice and square, and you press yourself back up. That's where I want you to be. Sitting it back, you're welcome. Press on up. Now put flashlights in your hands, point your flashlight straight forward. I'm going to come forward so you can hear me. From this position, I want you to turn out your standing leg. You're going to have to do that by pivoting around the corner. Notice what I didn't do. I didn't turn out my working leg. This is harder than it looks because most people are going to go with their shoulders. Notice where my flashlights are pointing. You want your flashlights to go around the corner. Ideally, if I had perfect turnout, my flashlights would be pointing this way. But my flashlights end up pointing about here and come back forward. We're going to try to stay on one foot and keep doing that. Right up on top of that leg, feel that turnout. And feel it come back around. So feel like that standing leg is pushing away and back to turn you around. Don't let your ribs go the way I just did, but feel the pelvis go around the standing leg. So here's my femur. My pelvis is going to pivot around it because my femur is fixed. And back in. Let's do the other side. Standing on it. Flashlights. And we're going to pivot. Think, turn that leg out, rotate that leg. This leg stays right in line with my body. Flashlights go with it. And come back in. I could let you turn this leg out, but I won't because I'm mean. And I want you to feel the difference between standing leg turnout and everything else spiraling away. I want your body to choose what's working. Try it again. Rotating around it. And back in. Let's switch back to the other leg. Let's do a little back leg turnout. From here, we're going to lift this back leg. We're going to turn out. So we're in a little bit of a hinge this way, right? This exercise I stole from Amy Warner. Hi, Amy. From Elevate Technique, which is a great cross-training class for dance schools and dance companies. So from here, we're going to lift that back leg up. We're going to turn out and we're going to turn out the back leg. Then we're going to turn in the back leg and turn in the front leg. So I'm staying in that plie, I'm reaching that leg back, and I'm going to turn out my standing leg, turn out my working leg, turn in my working leg, and turn back in. You will start to feel that. We're sitting back in a little bit of a hinge, just so I can feel it a little bit more. Turning in and turning in. Hands off makes it a lot harder. And reaching up makes it even harder. Let's switch to the other side. That leg back. And we're going to turn out the standing leg. And we're going to turn out the working leg. And then I'm going to turn in the working leg, but keep that standing leg turned out. Then I'm going to bring it back around. Think about where your flashlights are going. And then again, surgically reconstructed knee. So much less stable, isn't it? And then I'm going to turn in the working leg and come back around. One more time, turn out, turn out, turn in, turn in. Make sense? Yes? Okay, I know we're going to get cut off after an hour, so I just wanted to finish this up. Thank you so much for listening. You've got lying down exercises that you can do, clamshells, 90-90 with the lift, passe développé, lift front and side, and then you have standing exercises you can do as well. I hope this has been helpful for you guys. Let me know if you have any other questions, and I'm happy to answer them if I didn't answer them here. Don't forget to roll out your sacrum. Don't forget to roll out your tushy, everything else. Got questions? Let me know, or get in touch with Doctors for Dancers and they'll get the questions to me. Okay? Thank you so much. Okay, bye.